Good morning. Happy Saturday, everyone. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. It's a Saturday morning where I am. If you are watching us from a different state, please feel free to comment live or replay and let us know where you're checking in from so we can give you a shout out. Today, we're having conversations all in line to help our viewers, our clients, live long and well because we believe the quality of life is just as important as the quantity of life. And I'm excited to have a repeat guest, Dr. Makda Majette. And we're going to be talking about smoking. So smoke no more, tips on how to quit smoking for the last time. So I'm going to bring her on and then we'll go right ahead. All right, there we go. Hi, Doc. How are you?
Hi, Dr. Tolu. It's such a pleasure to be here with you again today and your audience, of course, and all the viewers that are watching.
Well, thank you for coming again.
Yeah.
Thank you for coming again. So on that note, for those who may not have watched the first time you came on, could you kindly introduce yourself? Who are you and what do you do?
Great. So I'm Dr. Makda Majette. I'm a family physician in Miami, Florida, and I'm also an HIV specialist. I am currently not open yet, but I'm in the process of opening a concierge family practice in Miami, Florida, and in the Brickell area. So if you're interested in being a part of my practice, which is telemedicine concierge home-based practice, please follow me on my social media at Doc Majette. You could also join my mailing list and get access to my newsletter. So that's what I'm doing, and I'm very excited to be here again with you, Dr. Tolu.
All right, awesome. And at the end of the show, I'll have all that information as to where people can connect with you, put on as well, so people can reach out to you. Now, my next question to you is, why do you do what you do? I know you wear many hats, even as a physician, but why did you venture out to decide, you know what, I'm going to open my own practice?
Well, the reason why I decided to open my own practice is because I really value being able to establish therapeutic relationships with my patients over time. And I like to have those time to spend to actually work on prevention and wellness that a lot of times we don't have in private practice or corporate medicine, because there is such a push for meeting metrics based on guidelines that are not necessarily what the patient needs or wants in that moment, right? So we have a lot of checklists to go through as far as preventive medicine, which are great, but I like to have more time to kind of see the underlying conditions and get to the root cause of our patients' issues. And I think with time and more care, you're able to listen more, to get a better understanding, to have a more healing relationship with patients. So that's why.
I agree. And I like that you're about to do that. I look forward to watching your journey too. Okay.
Thank you, Dr.
All right. Let's dig right to it. We're talking about how to quit smoking for the last time. So, Doc, my first question to you is this: what are helpful tips or techniques that have worked for people to quit smoking for good?
So I think it's first that people really need to know why. Like, why is it so important for them to quit smoking? So, most people they know that smoking is bad in a way, but for a lot of people, they're seeing some benefits to why they continue the habit, right? Because nicotine is very highly addictive. They're getting pleasure response from the nicotine in cigarettes, and it's very difficult to quit. So they have to know their why. Like, what is my why? And why do I want to quit? So is it because of, I realize the financial burden of having to buy cigarettes all the time. I'm realizing that the health burden of predisposition for cancers, or I'm realizing that I'm getting wrinkles faster because I've been smoking, or I'm concerned that I may develop that in the future, or I'm concerned about my lungs and the lungs and the health of my family. So what is your why? Why do you want to quit smoking? And then also assess what benefits have you been getting from smoking, right? So some people like smoking, they say, oh, for me, it relieves stress. I get to take a walk outside. I like to use my hands. I get to take a break from what I'm doing. And then after they assess that, they see that, not associate the smoking with, oh, I'm doing this bad thing. And then they get into a guilt, blame, shame cycle where, oh, I continue to smoke because I'm doing it and it's harmful to me, but I'm not saying why am I doing it? What benefits am I getting? What can I do as a healthy replacement instead, right? So with that being said, once you determine your why and you make the decision that, because I want whatever that decision is, I want to live longer, I want to breathe better, I want to reduce my risk of cancer, I want to it could be any reason that you personally have for why you want to quit smoking. After you have your why, make a decision, right? So the studies have shown that once you make a decision of a quit date, you're much likely to quit smoking. So determining a quit date is very important. And with that being said, also see in your corner, who can you elicit as an ally to help you in the process of quitting smoking? Is it your primary doctor? We're great allies as doctors to help our patients quit smoking. Do you have a family member that will be there for you and hold you accountable to help you quit smoking? There's also a lot of resources. In Florida, we have the Tobacco Free Florida website that will give you a supply, 2-week supply of nicotine replacement therapies, which nicotine is what makes cigarettes and tobacco products so addictive, because nicotine works on the receptors in our brain, those pleasure receptors, and it causes the addiction. So when we replace the nicotine, you are less likely to have cravings for cigarettes. The reason why cigarettes, cigars, and pipes are so dangerous is it's not just nicotine that they have. They have over 70 harmful cancer-causing chemicals in the smoke from these products. So the nicotine, you could change to a nicotine replacement therapy where you're actually getting those cancer receptors that hit without having exposure to those 70 cancerous chemicals. It's actually more than 70, but they have found at least 70 harmful cancer-causing chemicals in those products. So, like I said, so once you make a decision, come up with your why, make a decision, find your support. There's also the American Lung Association. They have a quit line resource as well, and that's national. The National Cancer Society also has free resources, and also some smokefree.gov has applications, like a mobile application that you can use, and also a quit line where you will get text messages and phone calls and inspiration to also quit smoking. So come up with a whole team and make the decision and have that support for when you're going to have, because that's natural to have cravings. And it's also natural to not only quit once, right? So this may be your 5th attempt at quitting, your 6th attempt at quitting, right? There's a famous quote by Mark Twain that says, I tried to quit smoking 99 times. It was something like that. So it's okay. And I encourage patients, like, it's, look at how successful you were in the past. Like, because patients will say, I quit smoking for 6 months. And I'm like, and then they're like, oh, but I started again. I'm like, well, you quit for 6 months. How did you do it? That's wonderful. Count that as a win. And the next time you try to quit again, see how much longer you can go. Like, okay, so let's try 7 months. And, let's try to see how long you can go this time, and make sure you have all of those support systems in play. Or what was it that what was the strength of how you were able to do that last time, and how can we create that scenario again? How can we repeat that scenario again for you? Yeah, so it's part of that process. That's what I would say as far as developing the plan and some resources that can help.
So it's a multifaceted approach. So it's getting the support systems, it's remembering what you used to quit before, it's remembering your why, and it's trying to address the craving without actually, taking all the extra crap that comes with cigarettes. One of the things I've found, Dr. Makda, is that, the deep breathing aspect to smoking, because when you smoke, you're deep breathing, and that by itself is known to be very helpful. It makes cigarette smoking alluring. So deep breathing techniques I found also help. I was just like, yeah, why would you want, why do you smoke? And like, it's so relaxing. I'm like, yeah, that's why. It's just, we don't want you to get all that crap in. So for those who are watching, a lot of tips Dr. Makda has dropped here. Get your support system. There are resources. Some of them are free. And we'll talk more about that, because I want us to hone in on that as well. Now, let's talk about the cravings. You already alluded to that. One of the concerns people have is that, the cravings are very, very, they can be very powerful, and when they're not addressed, they get irritable, they get cranky, and essentially having withdrawal symptoms. Are there practical strategies? Oh my gosh, sorry.
It's okay.
Are there practical strategies on how to deal with cravings and withdrawal symptoms when trying to quit smoking?
Right. So with that, there's medications, right, that help with cravings. We talked about nicotine replacement therapies. Those will help with cravings. Some of them are expensive over the counter, but like I said, you could also find free resources for those. So ask your physician, your provider. You could even search the American Lung Association website, also the National Cancer Society website, where they have free resources. Tobacco-free Florida, for all my people in Florida. They have free resources for nicotine replacement therapies. So that will help relieve the cravings. And I love what you said, deep breathing, Dr. Tolu. I think that, I love meditation and deep breathing. So, and it's so important, because a lot of us actually don't take full deep breaths to get in the oxygen that we need, right? So you're not getting the fresh air and oxygen when you're breathing in a cigarette. So you think that it's helping you relax, but it's at the end of the day, it's not, because it is affecting, you're getting those harmful chemicals, and you're also getting that nicotine, which does affect the pleasure centers, right? So you get that positive feedback in terms of the nicotine. However, if you take a minute and just take a deep breath instead, learn how to take a deep breath, relax, change your mindset. So it depends what the cigarette was doing for you. Like, it depends on the person, right? So sometimes the person says, yeah, I get to take a break. In that case, we could teach them deep breathing exercise. Put one hand on your chest, one hand on your belly. Breathe in through your nose and feel your belly rise, and let your belly fall, and try to do that, and take a breath over 3 to 5 seconds and see, the difference that it makes in your day. Like if I take a minute, or guided visualization, where you just, take 5-10 minutes to be at a beach, even though you are at work somewhere, maybe stressful. You can close your eyes for 10 minutes and imagine that you're on a beach somewhere, and just get your nervous system to calm down. Because smoking and tobacco products, the studies have shown that people with high stress, history of either mental conditions, anxiety, depression, all of those things, have a much higher likelihood to smoke. Much higher likelihood. So it's important to address those conditions. If you feel like you're feeling worried all the time, anxious all the time, having other issues, try to treat those issues, and not to cover it up with the cigarette, because you're creating another another problem, even though you may think that it's helping you, because it takes your mind away from what you may be dealing with. I speak to my patients about, how can we change that unhealthy coping mechanism that you have to a healthier coping mechanism, right? Like you said, which is a deep breathing or something different that they can do. Sometimes it's an oral fixation, right? So
yeah, I'm going to ask that question. Like,
yeah.
I'm going to start eating more, doc. Help me. What am I going to do?
In your mouth, or you just want to put something in your hand. So maybe you could have them put something else. Or some people do like a rubber band, and instead of a cigarette, maybe they'll pop the rubber band, or maybe they'll have a hard candy. But of course, hard candy is sugar, so it's not the best. But some people will do those little baby cigarettes, not baby cigarettes, baby carrots, or celery, because you can make the celery. You can eat the celery between your fingers. That to have that sensation of putting something in your hands, putting something near your mouth, because that's also a habit that was formed from the cigarettes. Yeah.
That's true. Very practical tips. I encourage each and every one of us to take notes and share with those who could find this useful, because these tips can actually help. And I like how you talk about addressing the underlying issue. Sometimes it's not like, oh, yes, I know smoking is bad. Yeah, let me go smoking. No, it's more, I need to de-stress. I feel anxious all the time. This helps me relax. I feel depressed. This helps me undepressed, be not depressed. You understand? This helps me relax. And so when we get to the underlying issue and treat that, then some of these things kind of fall by the wayside over time. Now, we'll talk about other options too, maybe further down. But I was going to ask this question. Some of my clients, a lot of them are social smokers. They smoke because people around them smoke. And so, do you have any tips on how creating a smoke-free environment at home and in public places can help with with quitting smoking? And also, I do have tips for those who say this is like my hangout zone. What you trying to get rid of my friends, doc? What you doing?
So I definitely don't want to get rid of friends, right? We all need friends. Humans, we're social creatures, most of us. So it's good, So it's good to have your social networks, your community networks. But now there's so many rules and regulations about smoke-free environments. So most of our school settings, hospital settings, are smoke-free environments, which helps because people that are trying to quit smoking are not seeing other people smoking, so they're not getting that craving to smoke as easily. So it's you're more likely to quit. So creating a barrier. So if you were trying to create a smoke-free environment in your home, creating a barrier between having the smoking being readily available will help you in your future decision to quit, because you're making it a harder step. You're making a step in between. So you can make a decision that I'm not going to smoke in my home. I am going to go outside of my home to smoke. Okay. So if you make that decision, you're less likely, you're going to reduce the amount of cigarettes that you smoke. Because if you wake up in the morning and you think I have to go outside to smoke, and that means I have to get dressed and then go outside and then smoke. So you're creating a barrier, and that barrier will reduce the amount. That will help you to reduce the amount you smoke. Also, it will help you have less of those more than 70 harmful toxic chemicals in your home, right? Because we know that smoke stays in every surface, right? So it'll stay in the air, it'll be on your couch, your clothes. It stays there. And it's not just the smoke. All of those harmful chemicals are infecting your environment and your animals and your children, other people in the household. So that did not make that decision to smoke, right? But they are also living in your same environment. But if you make that decision to say, you know what, I'm just going to keep my home smoke-free. I may still smoke cigarettes for now, but I'm going to make it harder for me, because I know I made the decision that this is not that healthy for me. So I'm going to make it a little harder for me to smoke. So I am going to smoke just outside of the house. And you will notice that you will reduce the amount that you smoke because that's just something that helps. Because, and I say the same thing about bringing in like junk food to the home. That's my advice. Okay. Advice. So, potato chips, candies. So I try to avoid bringing those into the home because I know once I have a bag of Snickers in the closet, it's gonna get,
Can't go to waste.
It's gonna get eaten, right? So instead of bringing those substances into your home, try, you may find it outside. Someone may be offering candy one day, or you may buy one candy. You're not having a constant supply, so you're reducing the amount. So for unhealthy things, it's good to have that, make a barrier where I'm going to make it a little bit harder for me to do this.
I like that. And that's a good segue to our next question. Are there other alternative therapies or treatment that can help in quitting smoking, like acupuncture and hypnotherapy? What are your thoughts on that, Doc?
Yeah, I think so. I had a lot of patients that said hypnotherapy worked for them after one session.
Yeah.
I was surprised, but they said that worked for them immediately after one session. They were good. So the studies are not clear on hypnotherapy. I haven't seen like a peer-reviewed medical literature that hypnotherapy for smoking, but the studies do show that the nicotine I had a lot of patient cases that said that it worked for them and they completely quit for years. So it's something to try, but don't feel that if you do not do well with that, then like I said, you keep trying. That's the thing about smoking. Quit. Don't think I tried to quit before and I can't quit again. Keep trying. Every time that you quit, you're moving up a level, right? It's you're moving up a level. So eventually you will get there. You can quit 100 times. That's okay. Just start fresh. It's a new day. Try again.
This one comes to my mind. If at first you don't succeed,
get yourself up and try again.
I'm serious. Like, and people give
It's true.
many times, but please keep trying over and over. As long as you're alive, there's hope to keep trying.
Yeah, as long as you're alive, you get a reset. Every 24 hours is a reset. Thank God the sun has risen again. You can try again. There you go.
That is right. Now, I've had a patient tell me, because I asked them, like those who quit, I always ask for their tips so I can share with others. And one told me that they do this thing where they freeze the cigarettes. So the cigarettes have to thaw before they're able to smoke it. And it got to a point where it was taking too long to thaw. And they were like, I don't think I want it. And it worked. So I tried it. I tried it a few patients and they tried it. And maybe one or two, I remember, said it helped with them quitting. But I thought that was an interesting concept. They're like, a friend of them told them, I tried to look up, there's any data, but of course, there's no, well, not of course, there's no data on that.
Right.
But that was interesting. Now, my next question to you is this. Let's talk of some of the common challenges or things to consider when trying to quit smoking. And the reason why I wanted to bring this up before we wrap up is that, people, it's not going to be like a walk in the park. So but it's not a reason to get discouraged. So what are potential challenges? So people, when they hear this, they're like, oh, I knew this. She said this was going to happen. So, okay, I was prepared for it. I anticipated it. So I'm ready for it. What are common challenges, would you say?
So the biggest one would be withdrawals. So, your body has become, the chemicals in your brain have adjusted to the nicotine. So these, the nicotine receptors, the nicotine cholinergic receptors, they need that nicotine now, right? So if you try to quit cold turkey, many people have done it. You can do it as well, but you may have withdrawal symptoms. So that may be like almost like chills. They have you may feel anxious. You may have these withdrawal symptoms, nauseous. So it's good to know that I may have this if I quit smoking, especially if I was smoking a good amount of cigarettes. I may have these things. So let me see if I can do nicotine replacement therapy. And know if I was smoking a pack of cigarettes, my dose of nicotine replacement therapy is different than someone that was a pack of cigarettes a day versus someone that was only smoking a half a pack or less a day. So the dose of your nicotine replacement therapy depends on how much you were smoking before, because you don't want to, you were only smoking a little bit and now you're doing a high dose nicotine replacement therapy, and you have to match the amount you're smoking to the nicotine replacement that you do. Which all that information can be given to you by your provider or the pharmacist when you do pick up those prescriptions. They have the instructions on the back of the label as well. It'll say if you're smoking a half a pack a day, how much the nicotine replacement therapy that you need will be. So it's important to know, because to know that you may not feel good for those first few weeks after quitting smoking. You may experience like cravings for food instead. You may try to switch it with another addiction, right? Because your brain has a predisposition towards having an addiction if you have that nicotine addiction. So just be careful of what you use, especially if it's something that's not as healthy as it could be, right? So if you use candy instead, or if you junk food instead, because people do gain weight after quitting smoking, because nicotine is also an appetite suppressant. Your appetite will increase. Just keep all of these things in mind so that you're prepared when the time comes, so that you have, so instead of smoking, I'm going to take a walk, I'm going to do something, I'm going to get fresh air, I'm going to exercise, I'm going to eat the celery, right, or carrots, or I'm going to do something that I know is going to be beneficial for my health overall. I'm going to replace the unhealthy habit with a healthier alternative.
Awesome. So I like that you talked about challenges, the withdrawal. Remembering your why is also very important. Sometimes the challenges is like your circle with friends are like, well, you don't smoke, what's up with you? But please remember your why, because in the end, it's your life. It's your life. So really worth it.
Right.
So my last question, go ahead.
So I don't think I answered about the friend. So the friend, remember that it is your life. You have to make the decision for yourself, right? So you cannot control your friends. So some people will say, I can't quit smoking until my wife or my partner quits smoking. So they're going to delay their onset to quit smoking because they're waiting on someone else. So I've had people say that, or they're waiting on their friends. You have to make the decision for you. And sometimes that means standing alone for a time period, right? So it may not be forever, but you may need to make that decision to stand alone because your goal is important for your health, your family, your future. And then your friends will see you and hopefully they will change. And some of them will, some of them may not, but that is that's important to make that decision for yourself and your goal.
For yourself and for your goals. Who knows? You can influence them to also change.
Right. And you could, and I'm sure some of them will. They will be inspired by you.
That's right.
They'll be inspired by you.
That's right.
But you can't wait for someone else to change for you to make the decision to change, because you have to make that decision on your own, and you have to stand. You have to make the decision on your own, but you will have support around you if you ask for it once you decide.
That's beautiful. Once you decide, you ask for the support. You have your own new support system to help you as you make that decision. So on a final note, Doc, I have someone who's watching who's like, yes, I know I should quit smoking. I know the benefits of quitting smoking. I know it helps increase my quality of life, helps me live longer, helps my skin look better, helps me smell better, different things. But I don't know, Doc. I feel a little overwhelmed. I feel like that's a big part of my life. What could we say to encourage such viewers who are watching right now?
We say take it just one day at a time. You can make that decision for the future. Make it be, work on one goal at a, you can make that your one goal for the future. Set that quit date if you know that's what you want to do. Or you can say, I want to at least cut down by half by this date. I'm going to cut down. I was smoking a pack a day. I'm going to get to a half a pack a day in 1 month. And then in 2 months, I want to be at 0. If that's your plan. And then we can come up with a plan. So that means during the first week, I'm going to reduce by 5 cigarettes. During the second week, I'm reduced by 5 more, right? So 20 cigarettes in a pack. And then see how that works for you. But start with small goals, and they say SMART goals, right? So make it specific, right? So specifically, my goal is to get from a 20 cigarettes a day to 0 in the next 2 months. Okay, specific, measurable. How am I going to measure that? I'm going to measure that by the numbers cigarettes I'm smoking, right? Is it achievable? Is that achievable for me? And that's important to assess with our patients too. Are they how confident are they in that decision that they're with? Yes. And if they're not confident, what can make them more confident? Like, so the discussion of, have you done this before? And they said, yes, I have done it before. I was able to do it for 6 months. Wow. How are you able to do that for 6 months? And they can tell you, well, I really made the decision. I didn't buy any cigarettes. I was able to quit cold turkey. Wow. So let's try. Can you try it again? How confident are you to do that? And if they say they're very confident, encourage their confidence and help them to move along, right? So we encourage if you feel confident you can do it, don't let anybody take the confidence away, and remember your successes. Remember, you were successful in so many things to get to where you are today, right? So think about all of the previous successes and how you can also be successful with this. Do not dwell on failures from the past, but use them as your learning opportunities. So I quit for 6 months, and then I had a relapse. Okay. Wow, you quit for 6 months. Let's start with that. That's amazing. So let's see if we can do that again. Don't dwell on the failure part of that, because they can quit again, and the next time will be successful, more successful. So that's what I would say overall about. And then so SMART goals, we said specific, measurable, achievable. I think I forgot the R, and then timing, right? Timing. So we put a time. So that's which is what we did by setting the quit date, which is so important. So important.
Awesome. Now, I know people are watching and feel encouraged, and they're like, you know what, I like this doctor. I want to connect with her. I want to, the R is realistic.
Realistic.
Yeah, whatever. But people want to connect with you and say, hey, doc, I want to work with you. I want to follow you. I'm in your neck of the woods. I may come see you as a patient. Where can people find you, doc?
Oh, thank you so much for asking that. So you can find me on, I have Facebook, Makda Majette on Facebook. I am on Instagram at Doc Majette, DocMajette. And those are the best places to find me. Please follow my page and I look forward. If you can, and you can also comment in this thread below, and I can, if you are interested in having some smoking resources, I'll send a letter for smoking resources about what we talked about today, so that you can go ahead and sign up for your, if you're in Florida, your tobacco-free Florida, or if you're in Texas, where Dr. Tolu is, or anywhere else in the United States, for resources to help you quit smoking if you want to make that decision.
Yes. Thank you so much for coming on a Saturday morning to do this with me. I'm sure our viewers are also very grateful. Thank you. Appreciate you, Dr. Makda.
Okay. Thank you so much, Dr. Tolu. Have a wonderful rest of your weekend.
Thank you. And thank you all for watching. Those of you who watch live, Cynthia, Mercy, thank you for joining. I can't see the rest of you, but thank you for joining as well. Please, as always, share this with those who can find this useful. For those of you who are watching who have tried multiple times or considering smoking, or who are not even sure you want to quit, I hope this has encouraged you to at least take a step further in your health journey towards a smoke-free you, okay? So share. You can always forward this video to people. You can actually tag them in the comments as well. But thank you for joining us on a Saturday morning. And as always, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician who will have conversations like this to help you live long and well, I am she. Have a good one. Thanks again, Doc.